Something like 1.6 million Canadians have some form of rosacea, a chronic skin disorder. It is a painful and embarrassing redness of the face that still mystifies some scientists. Experts are not sure what causes it, but there are many options for treating it. It is my pleasure to welcome from Pacific Dermaesthetics dermatologist, Professor Dr. Jason Rivers, back to Studio 4 to tell us more.
Hi, Fanny.
About rosacea. What is it exactly, or do we know?
Well, rosacea is often confused with acne, but it's not. And people have rosacea, and in Canada, it's almost 2 million people who have rosacea.
Really, I was low. I said 1.6.
And a lot of people don't even know that they have it. That's the problem.
Okay.
But basically, it's characterized by flushing and redness in the face. So people who become very high in color, whether it's from stress or exercise or drinking alcohol, they go very red and flush.
Really? Are there people who don't, like, when you work out hard, are there people who don't glow?
There are people who don't necessarily glow.
I see.
And then you can get pus pimples. It can affect your eyes even. And in late stages, you can end up like W.C. Fields with the big nose.
Right. Is it hereditary?
It does run in families. It's more common with the people who have like a Celtic background, so the Northern Europeans.
Sure, lighter skinned.
Right, exactly.
I know drinkers get blamed.
Exactly.
Right, he must be a drinker. Look at his nose.
Exactly. And
not necessarily so.
That's right. And not only that, I'd say about 76% of people who have rosacea are really quite embarrassed by this, to the point where about half of those people may avoid social contacts.
When does it first show up? What age?
In the 20s, people can start flushing, blushing, but it may occur later in the 30s and upwards, and more common in women than men, but it affects both groups.
And linked to anything in the body? I guess the real question is, what don't scientists know about it?
Well, we don't really know.
A lot. What causes it,
exactly.
like,
but
for instance?
There are theories, and there have been many theories over the years. One of them had to do with H. pylori, the bacteria that caused ulcers. That was cut down a few years ago. Mites on the skin called Demodex mites may contribute in some people, but the most recent theory, which seems to be holding water so far, is that there are these innate molecules that are on our skin called cathelicidins. Say that quickly.
Really? I'll say it, Professor. Give me a minute.
Right.
Cathelicidins?
Close. That's good.
Close.
So in any way, these are little molecules which sort of have an antimicrobial effect. But in people who have rosacea, they're changed a little bit, and when they're activated, they seem to cause inflammation rather than suppressing it. So people who have rosacea have more of these cathelicidins. So research is moving towards this area to see if we can block those and thereby reduce the inflammation in rosacea.
And do you have patients who can get rid of it or just treat it?
Well, there's no cure for it. But we can control the symptoms. And the first thing that you do is you identify trigger factors. So in one person it might be alcohol, another person it might be spicy food. So people can take a diary or start keeping a record of what are the things that cause them to flare up.
So every time I have hot curry, my face gets red, that's a sign.
Exactly. And so you want to try and reduce that somewhat. Either don't eat as hot a curry or eat it less frequently.
Okay. And alcohol, curry, spicy foods, anything else?
Alcohol, exercise, stress, basically living in some people.
Really, pretty much.
Yeah.
So does it hurt?
In some people it can be cause stinging and burning on the skin. And people who have rosacea have an altered barrier function on their skin. So their skin is much more sensitive. So a lot of times they can't tolerate things like astringents on the skin or peels.
So if you were treating President Bill Clinton, and obviously somebody has, or
right.
continues to.
Correct.
What are the options?
Well, it depends, again, on your degree of involvement. And so if it's somebody who just flushes and blushes a lot, right now you try and, again, avoid the trigger factors, cool water. If somebody, for example, gets red after exercise, if you splash some cool water on your face, that will help.
Right.
To begin with, as I mentioned, the barrier function is compromised somewhat, so a moisturizer is very good for the skin, a gentle cleanser, and sunscreen as well, because sunlight can trigger off people.
Really? So a cooler shower, I'm thinking, rather than a hotter shower,
exactly.
Or does it matter?
Exactly. A cooler shower is right.
And sunscreen?
Sunscreen. And then
Good for all of us, you say.
all the time. And then the other thing is, of course, medications, and they can be either topical medications in the form of antibiotics that are used, anti-inflammatory agents, and then if somebody has fairly significant disease, then we go to oral agents like oral antibiotics or even things like Accutane in severe cases.
Okay, and how severe does it get?
Well, it can become extremely severe and debilitating. There are people who literally can't go to work because of it, because it is so literally in your face. You know, you're very red. You've got these pus pimples everywhere. It's stigmatized because of this association with drinking, and so people are very demoralized by it. So it can become quite a significant issue. And not only that, as I mentioned, it can affect the eyes, and some people have real problems with just bright lights. Okay,
so not necessarily your sight, but
well,
your light
it's not so much the sight, but it can cause an irritation in the eyes, light sensitivity. Vision is usually not affected by this.
So daily routine, if you have rosacea, things to do, creams to use.
Right. Well, first thing, as I mentioned, is try and avoid trigger factors.
Right.
Second of all, mild cleansers for your skin and a moisturizer because your barrier function is compromised. And that should be a fragrance-free product. It should be a product that has simple ingredients in it, and we don't have time really to go into that too much detail right now. And then, as I mentioned, a sunscreen as well.
Sure. But your Riversol, I know it has cedar in it.
Right.
Any links there?
Well, it's not actually cedar. It's a molecule that comes from the red cedar tree. It's called thuioplysin.
Not being a scientist, I don't mean that there's twigs in it.
No
but
twigs.
It's from the red cedar tree.
Exactly.
It's extracted.
Exactly. And the molecule is an interesting molecule that I was introduced to about a decade ago from the Department of Forestry at UBC, and it has a number of interesting components to it, that it's antimicrobial, it's anti-inflammatory, and it is antifungal as well. So it has a lot of positive effects. And for some reason, we found just by chance that people who have sensitive skin tolerate this quite well, and even people who have rosacea can tolerate this product. It's one of many, but it's...
Sure. If people have dark skin, do they have it but you can't see it?
Well, anybody can get rosacea. You're right. I have people who are East Indian who can get rosacea. Much less common, of course, but you can identify that.
So what does it have to do with skin color? Do you know?
Well, it's not so much the skin color, but probably the genetics of the people who have that color.
Okay. So would you be better not to get it to have an oily skin or a dry skin?
Well, people who have rosacea can have combination skin too.
Okay.
But as I mentioned, regardless, the barrier function is mucked up a bit, and so you need to restore that, and moisturization helps that.
And does it help when you get it at the beginning? In other words, you see
Early?
some signs when you're 20, if you start treating it then, as opposed to when you're 40?
Yes, you're right. I mean, if you identify things early, you don't get a progression, because what happens with rosacea as well is, and one of the things we use for later stage is using lasers, because of the fact that with this flushing and blushing, blood vessels open and close. Eventually, some of these vessels stay open, and so you see these, these little track-like blood vessels on the nose, on the cheeks, and those can be addressed with laser.
And are those broken capillaries necessarily?
Well, we call them broken, but they're actually dilated.
They're just dilated.
Bigger, yeah.
Because the IPL treatment is, I don't know what you use, the laser treatment for capillaries and when you have broken blood vessels.
Right, exactly. You can use IPL, but I prefer laser because it's more targeted to the vessels.
Okay, and what is the difference between a laser and or is this going to take an hour?
Good, but we'll make it 2 seconds.
IPL stands for intense
pulse light, and it's basically a broadband light source that has filters on it, which thereby give you specific wavelengths. But it is not the same as a laser, which is one wavelength, which is coherent, means that all the lights come in together and you don't lose the energy as you're firing the laser.
So in your practice, you would use IPL for
people that have
aging?
Aging, mild pigment irregularities.
Brown spots?
On the skin, yes, and sometimes these vessels. But if I have somebody who specifically has a lot of vessels or vessels around the nose, I like to use a laser because the handpiece is also more conducive to treating because you can get around the folds.
Okay, and when you use a laser, is that gone forever, or does it come back? Is it temporary?
It depends on the person. I mean, some people, you have to do a couple of treatments, especially around the nose. Some people, it is permanent. Some people, they'll do well for 3 to 5 years, and then they need to do a touch-up.
Okay, so options are a little IPL, perhaps a laser, any kind of light therapy?
Well, not specifically at this
No.
point in time, no. But laser and, as you mentioned, intense pulse light are good for when you have these dilated vessels. And you do have to be careful because in some people who flush and blush, you're applying heat to the skin, and if you're doing too much, they can have a bit of a
Flush
flare.
and blush, or bruise, I suspect
Or
you could bruise.
Yes, except the lasers today are designed so that you don't bruise, so you don't see crusting or bruising. You're a little
Really?
red after. Yeah.
So how are they different today?
The lasers today are basically different in terms of the wave, the duration of the pulse that you have. So if you have a longer pulse duration, you can slowly cook the vessels,
Right.
which seals them. In the old days, the pulses were extremely fast, which caused a high energy, which could literally explode vessels, so you could be bruised as a result.
Okay, and do you use lasers on the legs, other parts of the body that could have a broken vessel?
Oh yeah, but it depends. I mean, for example, for people who have these large vessels or leg veins,
Right.
we will use often sclerotherapy. So we inject a salt solution into the
Okay,
skin.
and that's been around for a while.
Yeah, and that works very well.
Sclerotherapy. Right, but just those little ugly spider veins.
Those could be treated with laser.
Those can be treated, and you can treat brown spots with laser. What do you do for hands?
We can use a variety of lasers that, again, target the brown pigment in the skin.
So lots of anti-aging happening.
Lots of aging. We have an aging
No kidding.
population.
How young should people start, do you think?
In terms of what?
In
Treatment?
anti-aging treatment.
Well,
I know it's person dependent,
well,
but say you're 30 and you have a crease, or you're,
Well,
which you will have.
Right, it depends on the person. I mean, if you're not bothered by it and you want to wear your smile lines with honor, then you don't have to do anything.
Sure.
But the bottom line in terms of anti-aging, if you will, is to use a sunscreen. I mean, that's a cornerstone of treatment. And the
Right.
next thing is to use topical retinoids, which are vitamin A derivatives, which can help to reverse some of the damaging issues from the sun.
Okay.
And then from there you progress into things. So there are things like Botox and fillers, depending on the person's state.
So, but rosacea not helped with a Botox or anything like that.
Not
It's totally
specifically, no.
different.
Totally different.
Okay, because it's rosacea month.
It's rosacea month.
You
and
knew that.
I did know that. And I mean, there are a lot of people who have rosacea.
Yes, very much so. Thank you. 2 million, you tell me.
Thanks, Fanny.
Thank you.